Thank you again for joining us to another session of Top Virtual Staffing Solutions Virtual Town Hall. And we are really blessed to go ahead and have Dr. TERRI Hill. She is a state delegate here in Howard County and Baltimore area as well. Yeah, that's correct, right? For both counties, yes. Okay.
Howard County and Baltimore County, right.
Yes, for Howard County and Baltimore County. And we will be discussing COVID-19 in terms of policies, health and wellness, and business, which she encompasses all three. And then at the same time, we are going to touch base the sensitive issue, but it's rather important to discuss it as well with what happened in Minneapolis, specifically with Mr. Floyd, wherein he is one among many who has suffered such situations, if you may. So I am not an expert with these things, so I'm glad that Dr. Hill is here to help guide us with these conversations. All right, so Dr. Hill, welcome.
Hey, Manuel, thank you so much for inviting me.
Mm-hmm. And before we continue here, Dr. Hill, just as if somebody else joins in here, we're just posting these legalese, if you may, that we are recording this, and we're going to go ahead and publish this. And at the end of the day, what we will be learning from our guest with this session and for future sessions, that this is not this is just for informational and educational purposes only, and this is not super prescriptive, if you may. So please make sure you reach out to your subject matter experts with whatever we'll discuss. So, all right, so we're done with that. Dr. Hill, where do you want to begin?
You know, it's just a really challenging time, and so we can begin with just updating on where we are with the COVID, and then we can, you know, go where the conversation takes us, particularly with respect to the current focus and attention in light of the most recent 3 nationally publicized killings of unarmed Black people, and the response around the nation to it. Since, you know, in some ways, because the COVID situation changes so rapidly, it may be a lot quicker just to sort of talk about that a little bit.
Mm-hmm. Sounds good. And that's what it is. Even prior to this, we are already facing all of these issues, and then it's both good and not so good, wherein that it's just unfortunate that this has to happen again before we are moving in this direction to have this conversation, and hopefully it doesn't just end with conversations, but have whatever positive and constructive changes that we can make. So with that, and when we recorded the teaser a few weeks ago, we were talking about things slowly opening up, and that's what we have been doing. And what can you go ahead and share from the delegate side, from the business side? What can you share regarding that?
As you and your viewers know, your listeners know, here in Maryland, we have been opening up jurisdictionally for the past 2 weeks, actually a little longer. Ocean City, it's been more than 2 weekends now since I believe Ocean City first started opening up. And we did see an uptick in hospital admissions after they were trending down in the last week. But so far that doesn't look like it's sustainable. But I think that many of us in health and in government are kind of holding our breath and crossing our fingers, not wishing for something bad to happen, but trying to be prepared, because there's just a sense that while many of Maryland's residents have been very careful to try and be respectful of the distancing and the masking and other things that are designed to try and make it relatively safe for us to be out and about, getting back to our new normal. It's really clear that there are other people who sort of either feel that they're immune, don't care about how they may be impacting the health of other people, or feel like it's just a joke and that everything can just go back. And so there's a great deal of concern that because of that, of those folks, that we may indeed see another bump up. And from a business standpoint, as well as a legislative standpoint, we're really hoping not, because we'd really prefer not to have to have the stay-at-home orders restarted. We'd like to not have to tell restaurants and other businesses and retail that they have to go back and shut down again, because we, as responsible adult residents, haven't been able to simply follow the rules. So, we're just kind of waiting it out and see what the first week or two in June show us. And hoping that the little uptick that we saw for a few days in the past week are just blips on the screen.
Sounds good. And on that note, and this is where, for us as a business owner, for us as a community member, and given that there are so many different things that we have been hearing, so obviously there's the federal level, there's the state level, and there's the local level.
Correct.
For example, when Howard County Executive Dr. Ball was a guest for the Howard County Chamber, and he was discussing why there are certain things that's a little bit different from what Governor Hogan has identified in terms of reopening. So even we have these differences, and I understand it, but I can imagine that not all community members will understand who to listen to, if you may.
Right.
That, well, the federal government said this, or the CDC says that, the governor says this, and then the county executive says this. So on that note, maybe first, as a community member, what's the best way to navigate such differences, number one? And number two, as for business owners, how can we implement certain things? Because, for example, if both of us are restaurants and you're practicing differently from mine, and now it doesn't look, now it's weird, and to say the least. So I hope you understand my long question there.
And I think that the best way for folks to approach it, and the way most business people who I've been in contact are approaching it, is you're doing what the local folks are saying, and then applying the guidelines from every higher level. And what that means is, generally speaking, at least in Maryland, the local jurisdictions are evaluating what their situation is at ground level, what their incidents are, how dense their populations are, and what kind of behavior they're seeing, and making decisions about, based on the behavior of their residents, and again, how the disease is presenting, making decisions that are very particular to their jurisdiction. As we go up to the state and the federal, there are sort of these grand sweeping directives that are designed to try and keep everyone safe, but by definition, it can't take on the nuances that make each jurisdiction unique. That being said, as the local jurisdictions are saying, okay, we're now being safe, we feel safe, allow this, that, and the other thing. And remember that if things go sideways, it's going to be the local jurisdictions that have to first see it and deal with it.
Mhm.
They're then saying, but what are the best guidelines that I can look at as a business person to try and make sure that my business, once opened, won't have to close down again? So that means I have to keep myself safe and healthy. I have to keep my employees safe and healthy. I have to make sure that folks who are coming in to do business with us or coming up to do business with us are feeling secure and safe, because the last thing that any business wants is to find that they were the site of a new outbreak starting, because it's going to be really hard to rebuild that trust.
Yeah.
Right? So they'll say, okay, well, my local jurisdiction says it's okay for us to do outdoor seating for restaurants, say. The CDC says we still want to, require masking, and we still want to require cleansing up in between, and we still want to require the things. So we're going to see how we can incorporate that. Obviously, if we're a restaurant, people aren't going to be able to eat with their mask on. So what will we require? Will we require that our servers do it? Will we require, as some local jurisdictions or the state said, I think the state says, for instance, that the menus have to be disposable, because the idea is they don't want things being passed from hand to hand to hand with different customers and things coming in. So they'll have to look at the guidelines from the federal and state level to tell them how best to do what they are locally being allowed to do. Churches are another thing, despite the president loudly touting and many of our, the anti-public health protesters, who place this as a First Amendment versus health friction, where it really wasn't, in my opinion. They were screaming for churches to open, and there were few pastors and ministers who were leading that. In reality, across the nation, what we saw over and over again was that the vast majority of faith leaders were not feeling comfortable with putting themselves and their parishioners and their members at risk. So they've been much more deliberate about making sure, whether it's having services outside, whether it's recognizing that if we have you come in to the church or the synagogue or the temple or the mosque or whatever the prayer space is, that we have an obligation to do a lot of sanitizing after you leave. And that's a big burden. What we're also seeing, and I think this has a lot of our local officials really kind of sitting a little bit on pins and needles, is that one of the main reasons for the stay-at-home directives early on, as this thing was really beginning to hit our communities and we needed to flatten the curve, was the realization that if everybody was out getting sick at one time, we didn't have enough protective equipment, PPE, mask, sanitizing wipes, gowns, gloves, all of that kind of stuff, face shields, to keep, first the healthcare workers, as you know, and then the other frontline people, and then frankly the essential workers. And it's really interesting that the essential employees who were, driving buses, working at processing plants, making sure that things were being delivered from the warehouse to your home or from the grocery store, they were really treated like, just afterthoughts. Oh, they should be protected too. So we tried to make sure there was enough for the doctors, nurses, and other healthcare professionals who are dealing with the sick, so they wouldn't get sick while taking care of the sick. And then as we saw these other folks getting sick, it's like, oh, you know what? We should probably protect you too, because we are putting you out there and exposing you to dozens or hundreds of people every day who could be infecting you. So, but a lot of that was just recognizing that there was a finite amount of, needed resources available. So we kind of got caught, we got caught up on those needs. We have some surplus available. But as we open businesses, those businesses are now competing for that same protective equipment, that same PPE. And so maybe for a week or two, the surpluses that we have will keep up. But if we are completely open, and everyone is requiring, masks are a little simpler because people have gotten used to the idea that they can make their own mask, and there are lots of people who are making masks for small profits and some for great profits, and some are giving them away. A lot harder to come by the gloves. I know in my medical practice, when I go through my usual medical suppliers and the usual chain, and I put an order in 2 weeks ago, and usual stuff, gloves, non-sterile gloves. They were like, okay, well, we're back ordered on that. So if you place that order, we're just going to take it off your list because we just don't have it. And so we're going, through the Amazons, some of the local suppliers, and there are some resources available for people. But my point is that we're now all going to be competing for basic supplies that are going to become routine for many of us. And I think the biggest one is sanitizer, whether you're talking about the prepackaged wipes or you're just talking about a disinfectant that you can get over the counter. Most people I know who've been to the store in the last several weeks know it's really difficult to find disinfectant at your regular stores. And if you get it, you get it because you get to the store on the right day soon after they had a delivery. And it's going to be off the shelf, pretty quickly. And most of the stores are actually limiting the number of these different products that that one person can purchase at a time. So, and those are the things that people are using in their homes. Those are the things, if we're going to be grilling and keeping social distance and having people over for the holidays, we're trying to do more out and about things. If we're going to start opening, theaters or stuff like that, if it doesn't matter how much people are willing to sanitize after a crowd comes in, if you don't have the supplies to do that,
yes,
you can't do it. And I think that's going to be the rate limiting step, assuming that we don't see an increase from some of the exposure that many of us feel has been a little bit irresponsible in the last 2 weeks that people have put themselves at risk for.
So again, this is a very complicated case, and everything is very much impacted. And so simple things, just like what you've identified, masks, gloves, and it's not like we have all of the surplus that we need.
Mm-hmm.
So that in itself is an issue. And then among other things, so if maybe my question to you first, as a medical professional, given whatever we know based on research right now, is it really safe to do however we're doing things right now? And then again, at the same time, I understand that it's by jurisdiction, by population, by density, by profession of the business or the practice itself. I know there's so many factors involved. That's why we can't just have a blanket statement, but at the same time, mm-hmm. I understand all of those are difficult things. But generally speaking, us opening up.
So I think the answer is that it's safer to open now than it was a month ago.
Okay.
Okay?
Okay.
To be able to have testing is helpful. Mm-hmm. To be able to, identify and isolate folks who have it. So now that you no longer need to fit certain categories to get tested. And there's more, testing is more widely available. Pharmacists can do tests, and every day in every jurisdiction in the state, there are new testing sites that are opening up, private or public, what have you. I think people are taking great comfort in that, but we just have to remember that there are healthcare experts that still have to be relied upon and referred to as we take these steps, as individuals and as governments. And I think the government gets it. I'm just not sure that all the residents do. Mm-hmm. So I was talking to a patient a couple of days ago who was, I forget what it was that they wanted to do. And they were saying, well, they were, I think they were going to visit a octogenarian relative who they hadn't seen in a while. Mm-hmm. And the issue was, have you been in isolation for a number of weeks and had any symptoms and all that kind of stuff? And they were like, yeah. And I said, but you're up and out, like you've come to my office, and even though we're masking and sanitizing and all that stuff, but you're getting out more and more. And so the question becomes, what risk are you putting your father at? And they said, well, if I get a test, then I'm good to go, right? And I said, well, if you get a test and you're negative, right, so you don't have it, that means on that day that you had the test, you're not showing positive. It doesn't mean that the day after you wouldn't be, because you were exposed the day before the test, and it took 2 or 3 days for your blood test to turn positive. I said, so it's probably likely that you're okay, but it really depends on what did you do between, the day or 2 days or 3 days before you took the test and what you did. So if you're out and going shopping and, just going everywhere, not wearing a mask and not being cautious, and you happen to get a snapshot in time that says you do not have it, that day you do not have it. And you'll have to ask, based on your behavior, are you safe with that piece of information going to see your father?
And if I may add a little bit more, not because you got tested right now, mm-hmm. It's not like an instant thing that you receive the results. Am I correct?
Right. So, well, actually the tests are coming back a lot quicker, depending on where you're having it done. So there are speedy tests that actually can come back in a few hours. I think the Abbott test that I and a lot of other people were really excited about, because it could give you a result within minutes. Okay. Proven not as reliable as people thought. And I don't recall, I think it has a lot of false negatives, meaning it tells people that they don't have it when they do. So the speedy tests generally are not as reliable, but for the most part, the testing is reliable. The other kind of test that people have been excited about is the one that says you have antibodies, meaning that you've had some exposure to it, even if you didn't know you were sick. And that's a wonderful thing to have, except people need to remember that we're still waiting for definitive science to tell us what that antibody protects you against and for how long. So your body making antibodies is a good thing, but we don't know for this particular organism whether it actually implies that you have immunity. And if so, if that immunity is for months, days, weeks, years, or forever. So it's nice to have it, but we can't yet make the leap that says, now I'm safe to just be around anybody because, whatever. We also know, as the interesting thing about this novel coronavirus is that we're finding, we find out things every week. So we also know that there are people who are showing that they have antibodies, who at least in some cases are testing for positive at the same time, or are still able to spread. So they may have antibodies. That doesn't mean that they won't pick it up again. So we're still trying to, figure out exactly what conclusions you can draw and what kind of behavior can be allowed because of the antibodies. Similarly, there was a lot of excitement about the research that has been going on into using the serum from people who have antibodies to the virus as a treatment or protection for people who have been exposed, to hopefully prevent them from becoming terrifically sick or ill. And that data is still not been reported. My understanding, and I don't have the inside track, is there have been some signs that it may actually be working well. And there are some signs that at least some of the formulations that people are putting together here may not be working so well. And they're still trying to figure out, even if it does work, is it for people who are at high risk and have become exposed so that they don't get worse? Is it really for people who aren't very sick so that they heal faster? But how can that be used? So we're still trying to get information, and the reason I really want people to be cautious and just remember that we don't have all the information and the things we think we know. Often we find out a week or 2 weeks or 3 weeks later that we were wrong. And we can look at a couple of examples. So in the very beginning, in February, March, when Marylanders started hearing that the coronavirus was in the US, and the CPAC conference, I think, was the big one, at least for us in Annapolis, that got people concerned because a lot of our members went to that conference. In the beginning, we were all being told, don't worry about wearing masks. And folks were saying, well, they're wearing them in South Korea, and they're wearing them in China, and they're wearing them other places. And our CDC and FDA officials and public health officials were saying, no, not necessary. Probably won't make a difference because the masks don't really stop you from getting anything. It may stop you from spreading stuff, but we don't think it spreads that far anyway. And to that issue, the point of the mask that we found out is the mask may not stop me from getting the virus from you, at least the mask that we're using in casual day-to-day dealings, but it does really mitigate against my passing any virus that I'm carrying on to you. So I wear my mask to protect you. So obviously within a month, we were finding out very differently. We had, documented cases where people in closed situations with distancing between them, like choirs, 6 feet apart, but over 2 or 3 hours of singing and vocalizing and just putting that out into the air, they were infecting, people. There were executives at a conference in Boston who, all but I think one of them ended up getting infected from 2 people at the conference who had it, and then they went out and infected other people. So we sort of then found out, oh, maybe masking is a good idea. And so that changed everything. We also kept saying, well, kids don't get very sick from it. It's not that big a deal. Although we were concerned from the beginning that all that meant is kids did not have mature enough immune systems to react to the virus, so they weren't getting sick because their body wasn't overreacting to it, but that didn't mean that they weren't carrying it, that didn't mean that they weren't vectors who were carrying a virus that we didn't know they were carrying because they weren't particularly sick and then bringing it home. But we didn't think they got sick. And of course, we now find out that there's a late disease that is linked to the virus that can be deadly, and it can cause really devastating illness, and it seems to show up weeks after whatever the children's exposure was. We're still trying to figure out what the significance of that is. And, if that's something that we're likely to see happen to a lot of our children, or just for a rare 2 or 3, and what those links may be if it's not a large group. And then the other thing we're finding out, is that for a lot of people, particularly the kids, they may never have actually seemed sick at all, except they might have had a rash for a day. And a lot of the information that we're getting is not just from the researchers, but it's from the doctors and health professionals, even the nurses who are online in private chat rooms or professional chat rooms and have been for the last 3 or 4 months, just sharing what they're seeing. And that's how we're finding out even about what works and what doesn't work. So you can expect that as the next month continues on, and we start to look at what are late cases looking like, and can you really get infected a second time, and what does that mean? We're going to be changing, again, what we're telling people that we need to do. So I want people to be, let me put it this way, I want people who are venturing out, who are opening businesses, who are going to businesses, to treat this seriously, to treat this as if their life depended on it, because it does.
Yes.
All right. So it doesn't mean that you don't, but don't be cavalier in how you approach it. It is, the all clear has not been sounded, and the all clear may not be sounded, if ever, right? It may not be sounded for quite a while. What has been sounded is an alert that says, be cautious, look both ways before crossing the streets, okay? Venture out. But you've got to be cautious because, again, it's as if your life depended on it, and it does.
So your life and your loved ones.
Right. Well, and that's the thing. It's the other thing, the messaging was kind of screwy in the beginning, because when scientists and the health professionals, public health professionals were saying, these are the vulnerable populations, they understood they were saying these are the people who, if they get sick, it could be very deadly. It can be a very devastating disease, and it can put them in the hospital. They were never saying that they're the only people who can get sick from the virus. But lay people were hearing, oh, well, they're the ones that are vulnerable, so I have nothing to worry about. And I'll just shirk it off and it'll feel like the flu. And we had, many a naysayer, who thought this was no big deal, who were in their 20s, 30s, and 40s, who died from it. So again, people need to be really careful to hear what officials are actually saying, instead of, just hearing what they want to hear. And I think the other thing that people are being, I believe, a little misled by is when the president and his spokespeople have said that they're doing this warp speed vaccine program. That sounds like we're going to have something, by October or earlier, and everything will get back to normal in the fall. I understand that's certainly possible, even though it may not be probable. But when I listen to the president's representatives describe what this warp speed vaccine program is going to be, it raises a lot of concerns for me. Because what I hear them saying is that there are a number of manufacturers and labs who have promising vaccine prospects. And what they want to do is to allow any number, maybe as many as 14 of these prospects, to come quickly to market, having removed a lot of the usual regulations so that they won't be delayed. And they want these different vaccines to be offered to large populations of Americans, maybe 10,000 per vaccine. And then we'll look and we'll see which vaccines work. And so it's just going to be, let the market decide of the highest caliber. We're just going to release this on the public, and we'll figure out what the good ones are. And that's capitalism. And there's nothing wrong with that, except that when you talk about public health and you talk about a vaccine, which by the nature of what vaccines are agents that are introduced into our bodies deliberately to elicit an immune response to prepare our bodies to fight an infectious agent, so that when we see the actual agent, we're prepared for it. And when we look at the nature of this pandemic and the need to remove much of the regulatory requirements that we have come as Americans to depend on to tell us that the products that we're taking are safe, we know that those were eased because of the need to get things out quickly for the pandemic. In addition to that, the federal government has given huge financial incentives to pharmaceutical companies and researchers to try and encourage them to get something quickly to market. In addition to that, the FDA has not only released a lot of regulations, they also not, apparently under this warp protocol, they're not requiring that these vaccine trials go through stage 2 or 3 trials. They are cutting them short and basically saying when you give it to the population, that will be the trial. And finally, as I understand it, and I know this was a vote, and I'm tracking down how the vote went, but there is a vaccine court that was set up in the 1980s to diminish the amount of litigation, because we've given pharmaceutical companies immunity against prosecution should they produce a vaccine that is harmful. So the vaccine court was set up so that people who are harmed by vaccines, and there's almost no drug that you can give where there aren't going to be some people who are harmed by it, so that those people will get compensated for whatever health or other problems resulted from them receiving the vaccine. So all of those things that as a consumer give us some sense that our government is looking out for our welfare have been removed in this warp speed vaccine program that the administration is roaring out. So they are voting, and again, I'm not sure if the vote has actually gone through or it's pending, to remove the coronavirus vaccine from the list of vaccines that will be covered by the court. So in summary, what it means is that the scrutiny that would go in up front to say to a pharmaceutical company, before we release this on the market, let's make sure that this pass, a rigorous safety review, those have been removed. Number two, they're immune for prosecution if they come out with a bad product. So the incentive to put out a good product is purely based on competition. And if you get sick, there is no mechanism for you, and you lose your livelihood, or you lose your life, or you lose a limb. There is no mechanism in place for this vaccine to compensate you for that injury. That's worrisome to me.
And as many things that could be worrisome with what you just added. And again, I'm so happy that you are here doing this right now because, because there are multifacets of events and situations in relation to COVID-19. And yes, vaccination is part of it. And then if I could clarify certain points, for example, when I had a medical doctor as well as a guest for this session a few weeks ago, one of the things that we discussed is that it's just going back to what you mentioned as well, that it's possible that I may have had it already and I was asymptomatic, but it's possible that I can still be impacted later on.
Right, we don't know.
Yeah.
But we know, for instance, with measles, that people who have chickenpox are prone to getting shingles later in life. So the virus simply lies dormant in our body and comes out 10, 20, 30 years later in a different form.
In different form.
So we don't know, and that's something we can't know until years go by about this virus, but we know what other viruses do and how they can manifest, right? So we don't know what it means. We also know that there are vaccines, I think the vaccine for whooping cough, I believe, pertussis. The original vaccine gave lifetime immunity. There were some side effects, and so the vaccine that kids get now is a weakened version of it. So it gives immunity, but it only gives it for like 4 years. Okay, so we have the polio vaccine, and people with polio, we thought that once you had it, that was that, but we're seeing people in their 50s, 60s, and 70s who are coming out with late effects of polio, something that they survived, but they're having a reflourishing of the virus in their bodies that's causing damage at a later date. So there's a lot we don't know, and that we can't know until we see how this plays out over decades. But there's also a lot that we just don't know about what this virus looks like, as I said, on a week-to-week, month-by-month basis. And I think the best example of that most people are aware of is this COVID or coronavirus-related total body inflammation, multi-system inflammation, inflammatory syndrome that children particularly are presenting with, and in some cases, ending up in ICUs or even dying.
And that's why, like what was mentioned in terms of messaging from the older generation, and then now it's impacting all the way to the kids. And that's what it is. We're learning as we go. Right. And it's unfortunate that there are pretty much, if you make collateral damage that takes place.
Right. And I think it's interesting that I heard someone say that, they didn't feel that talking about this as a war on a virus was the best metaphor, that this really is and it's an exposure, it's an education, and we're learning.
Mhm.
And, we're trying to learn as fast as we can what this is. And it's the learning environment that is so critical for how we ensure that the greatest number of people survive with the best quality of life. And it may well be that the kids that we're seeing, have some of the link. Maybe they all took a certain kind of asthma medication. Maybe they all took aspirin or Tylenol, or, maybe they all, who knows? Maybe they all had, a goldfish in the house. I don't know. And it's going to take a while to sort of flesh out who those kids are and what that means for other people and other children in terms of their likelihood of getting this late manifestation. It may even turn out that it has no relationship at all to corona, although it seems pretty clear that it does. So, again, I think that it's important for people not to get so excited about the reopening that they fail to touch base fairly regularly to find out what the new information is, as they can handle it. Some people can handle more information than others. Mm-hmm. And just, be trustful and mindful that the local government officials are trying to ensure that we keep as many people as healthy as possible. And that just serves us it serves us from a tax basis standpoint, it serves us from a business standpoint. And in past pandemics, from an economic standpoint, shutting down and closing the economy for a period of time did better long-term in terms of the economics of the community than those places that decided that they weren't going to put the public health processes in place and we're just going to tough through. They because the continual hit on the economy and the shocking hits on the economy, they're really hard to rebound from. We need to have some degree as business people of predictability and knowing that once we reopen that we're going to be able to continue. And that doesn't happen. It would not have happened had the steps that were taken to flatten the curve not been done.
All right. I also want to go back with the vaccination piece, because one of the things that I've learned, and I know prior COVID-19, for example, the typical flu shot, it's not, that in itself is not 100%. It doesn't have 100% efficacy. So people still get sick in spite of the flu shot, correct?
Mm-hmm. Yeah, and that's in part because of the nature of the particular virus or virium that caused the flu. They're rapidly changing. And so the flu shot every season is based on a prediction of what strains of the influenza virus are likely to appear in the coming season. And they gen up specific vaccines to each of those different strains. And they put that together. So when you get a flu shot, you're really getting a combination of several vaccines to several different strains of influenza. So the first thing that can happen is the predictions could have missed the flu or one of the strains that's going around, and you get the strain that's going around. The other things is it may have had the strain right, but between the seasons, it may have changed in some way. Its DNA characteristics may have changed, so that the particular vaccine, even though it identified the right flu, is just not predictive. So maybe the vaccine was designed to affect the wall of the virus, and it's changed one of the proteins or the lipoproteins, meaning the components that make up that wall, and so that vaccine is no longer effective, right? Because your body just doesn't recognize it. So there are a number of reasons that happens. And then, of course, as with any vaccine or any kind of agent that we inject, there are a small number of people who simply just have a reaction to it. Or again, if we're trying to gen up an immune response, recognize that for for most things, we want a healthy immune response to fight infections, but our immune response, if put into overdrive, also causes a lot of our symptoms. So people with hay fever, they're having a natural reaction to allergens in the air, but they're sneezing and their eyes are running and they're having all this kind of stuff because their system is really geared up a little bit too much. And so we give them antihistamines and steroids and other things to calm down their immune response because we want them to respond, but we just want them to respond with a little bit less vigor. And so when we give a vaccine, we want to trigger a response, but for some people, the response itself is a little bit more. So they get a little fever or they get a little rash at the site or they get, something else. Those are considered side effects. They're not considered bad vaccine reactions. And there are other people who can get, bad vaccine reactions, but they're pretty low. And anybody who wants to go back and just review information about the Salk and the Sabin vaccines that were introduced to polio, one was brought to market very quickly. And there were a fairly significant number of folks who were injured, even killed by that. The other virus, the other vaccine was, rolled out very, very slowly. And of course, people died because it took so long to bring it, and got ill because it took so long to bring it to market. So there were pros and cons on both sides. But that's a really good historic lesson or historic case for us to look back. And I think public health officials really look back on that to say, okay, how can we do this right and how can we do this safely so that we injure as few people as possible, recognizing that there are risks to whatever we do. It's not clear all across the nation that our government officials are as concerned about learning lessons from those past experiences.
And on that note, if we tie it up to the vaccination for COVID-19 specifically, because even with rather proven or long-term studied vaccinations, it's still impacting human beings in different ways and forms, as you have already discussed or alluded to. And then if we're going to rush this, and I understand the benefits of it, obviously, but if we're going to rush it, the setback of that is we do not know how it's going to impact us to the point that people could actually die.
Right. And again, I'm not advocating that we don't move forward. I'm more concerned about the fact that we're moving forward and we've removed all the guardrails.
Yes.
Okay. So if we still said, okay, immunity is gone because we need, the pharmaceutical companies to put something out, immunity's gone, but if something happens, you can get compensation in the vaccine court. We're going to have a fund set up for that, just so people won't be out there, having lost life limb or who knows what, that if we kept that protection on. Or if we said, your immunity's gone and we're going to condense the trials that you have to go through to bring this to market. But instead of, take the example of Boeing and, the 737, where they were basically told by the regulators, we'll let you tell us if the changes you've made are substantial enough to require oversight or whether you think they're safe. And of course, it turned out that they told everybody that everything was fine and safe, and it wasn't. I think it's unfair to put the pressure on pharmaceutical companies to say, we're going to let you tell us if what you're doing is safe, right? It's tempting. It's a cookie jar with a lid open, right? And no matter how much people and corporations want to say we are good stewards, we all know that part of being a good steward is knowing that there's somebody watching your back, right? That there's somebody looking over your shoulder. Because the enthusiasm for bringing something to market, the enthusiasm even for making profits, the enthusiasm can be overwhelming, and sometimes we don't recognize our own blind spots. And that's what oversight and regulation are all about, making sure that somebody whose primary interest is different from yours is watching what you're doing. And so it's my concern about all of those things going away. The anti-vaccine people, of course, they'll manipulate that to say, stay away from all vaccines. That's not what I'm saying, but I am saying watch the administration very carefully in how they roll this out and in what their goals are. Their goals, public health goals, or their financial goals, frankly, are they political goals? And, make a decision when the time comes with, an effort to do due diligence to find out what it is that you're being asked to participate in, and what kind of safety regulations or mechanisms have been put in place to give you some sense that, okay, we're probably going to be okay. In other words, if the government is basically saying we're not going to do our usual due diligence, then it's not sufficient to say I'm an American and I trust that the government has already, they wouldn't let a product out that they hadn't tested themselves, right? Or what have you. So just know that we're doing things differently in this environment. That's all. I still think a vaccine is going to be very critical, but I'm going to listen to a Fauci, before I listen to, the head of, the CDC tell me, or for that matter, Mnuchin, tell me about how this stuff just needs to go forward. I'm going to listen to the health authorities about
the health authorities that are not invested on anything except for public health.
Right, who invested in telling the truth. Right.
Yes. And on that note, with everything that you just shared, flashbacks of one of the documentary that I have just watched, I mean, as you have discussed, of learning through history and with these situations, and it may be a little bit of a different analogy, but when you've identified, for example, with the Volkswagen emission testing issue, so
right.
When I saw the documentary, I understood all of those, because at the end of the day is that obviously if I'm this organization and if I have a roundabout on how I can get away from these regulations,
right.
And of course, we want to place good faith on everyone as much as possible,
right?
No doubt. But at the same time, we have to be critical that different motivations are involved. And if we are not 100% clear what these motivations are, then that's where it causes more problems than solutions.
Right.
And you're a medical doctor.
Right. The fox should not be watching the hen house.
Yes.
Right? It's basic. And it's just important for people to realize that that they just need to listen carefully to what the administrations at all levels, what is being said, and understand what that may be, and ask questions, right? That's all. I am not interested at all in feeding into any more of the sort of anti-government, you can't trust authority rhetoric that has played so dangerously into the moments that we're living. And, frankly, if we were going to segue from Corona and the COVID-19 pandemic to what we're seeing on the streets, it's the same thing. If once you tell people that they can't trust any authority, because all authority, if you look closely enough, has a history of sometimes having failed and sometimes not being as trustworthy. But once you foment that and people don't know where to turn, it makes it really easy for all of us to be manipulated by folks who don't have our best interests at heart. So if we talk about the protests over the asphyxiation death of George Floyd, people can condemn the violence, that's appropriate, but it shouldn't change the conversation. This conversation isn't about civil response. That's a side issue. The conversation is about by whose authority can an unarmed person be assassinated in public by law enforcement officials who are trained professionals whose charge is to preserve the peace and to protect the citizenry. That is the issue. And the issue is not just about George Floyd, as you sort of mentioned earlier. It's about why are we still having this conversation? And why is it that even when we take small incremental steps to change it, we're still not seeing the kind of change that we need to see? It's about not making the protesters become the story, right? Not getting distracted. We have folks right now with public platforms who are experts at distracting us from the real issues. They throw shiny objects up and have us look at that and sometimes be aghast at what we're seeing, while they're really doing the real dastardly stuff behind their backs with the other hand. And I just, again, we can have, protests can become, we had, 3 weeks ago, these anti-government, you can't take away my right to leave my home, you can't make me wear a mask, people with arms showing up at state houses. We did not see them being met with rubber bullets. We did not see police officers doing anything other than sort of standing there and taking it for the most part. And so when we have a president who now says that, the response to the original protest was too soft, the response to the original protest was exactly how these other folks have been responded to a few weeks ago. And when we know that there are agitators, as there were in Ferguson and there are other places, who see a ripe opportunity to frankly dig their thumbs into the big sore spot that is race in America, and to twist that thing and throw salt in it and see what they can stir up, then we need to be mindful of how they're trying to use us to tear ourselves down. I mean, as Americans and as communities. So communities of color, that doesn't mean that the protest shouldn't be going on. And it doesn't mean that, life and property should be protected. But as I heard some folks and the head of the NAACP in Minnesota, say that one of the problems they had when the governor sent in the National Guard is he sent nobody in to protect the protesters. He sent nobody in to protect the communities that were burning down. And so it was the community members that were going out there and having to stand guard in front of businesses. And when I hear the administration, the Trump administration say, and Attorney General Barr say that they know that the people stirring this up are Antifa, when the Minnesota folks are saying, we're not sure, we think there are agitators on both sides, and the Attorney General folks say, well, we're going to investigate the Antifa, instead of saying we're going to investigate so we can find out who are all the players on all sides who are trying to take advantage of it. And they've decided, as they have in the past, that we're going to name who we think it is, and we're going to authorize an investigation just into that group who we have had an issue with all along, but we're not going to look at the nationalists and the other groups who have been tracked online saying that they're going to take advantage of this opportunity to start a race war. So when they have prejudged who they're going to investigate, instead of saying, as they should, as the supreme law enforcement agency of this country, that we're going to investigate to find out who all the bad players are, and then we will follow up, we will take the investigation wherever it goes. They've made a predetermination of who is worthy for investigation. So that already has a bad smell, right? So, but we can't keep coming back and revisiting this same old thing. We just can't keep doing this. And a friend of mine was telling me, and he couldn't remember the name of the woman. It's a white, I think she's a professor, who was speaking recently before an all-white audience and asked them something to the effect of, would you please, everyone here, please stand up if you would like to be treated the way Black people in America are treated. And no one stood up. And she said, I'm sorry, maybe you didn't understand. I'd like anybody here who would be okay being treated the way Black people and other people of color are treated in America. Just get to your feet so I can identify who you are. And she said, okay, when no one stood up. So she said, I don't want to hear any more from any of you about how you don't understand what's going on. Because you do understand what's going on. And you've understood for a long time, right? I mean, that was essentially the point that she was making. So video or no video, whether it's, Breonna Taylor or Ahmaud Arbery or George Floyd, and I get really tired of people saying, well, Black people kill Black people all the time. It's Black on Black crime. It really is not about who is doing the hurting. It is about who is being held accountable. And so if I, as a Black woman, am shot and killed anywhere in the US by, say, a Black person, okay? And that person becomes known, I have no doubt that an arrest will be made and charges will be filed. What I do have doubt about is if a white person, whether law enforcement or not, shoots and kills a Black person, I'm not sure that charges will be filed. And if they're police, the evidence shows that charges won't. Mitch McConnell said at the Senate today, or Donald Trump, his spokesman said on one of the Sunday shows yesterday, that we are not like China and these other places where if, there's brutality against your citizens, it's the government doing it and you walk away. He said, this is America and we investigate. And I said, no, this is the point. That is exactly the point. This is America and we don't investigate. This is America and government sanctioned law enforcement are not generally held accountable. If they were, there wouldn't be the protests on the streets, right? That is the point. And the fact that his administration doesn't understand and McConnell doesn't understand that this is the norm, that people are not held accountable, that for an arrest to be made of 1 out of 4 officers is a big deal because it typically doesn't happen. Okay, that we need video for charges to be even entertained and filed. And that the vast majority of time, when we've even been aware of these things, regardless of what the video shows, acquittals are acquittals, 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 acquittals. So we have a problem. We rely on law enforcement, and we have every right to rely on law enforcement. And it's not, a bad apple is a bad apple. But if the entire crate is rotten from the inside out, then we need to empty it out. And frankly, even, and I'm a huge supporter of law enforcement and family members, and, have appreciated local law enforcement support in my candidacies. But I need them to own up to their own stuff. I don't need them every time something happens, to say, well, what's the back history of the perpetrator who was killed? We know he used to be you didn't know anything at the time. You didn't know anything. You just, after they were dead, somebody went back to try and come up with some backstory to explain why maybe this death was a justified assassination without going through trial, or that since they were a bad guy, they didn't have a right to due process. They didn't know any of that stuff when they stopped the person on the street. And I get really tired of that being the automatic response. And the list just goes on and on and on. And I'm inspired by the multicultural outpouring.
And even global.
And globally. We got very upset when we saw, the Hong Kong protests and how China was coming down on this. And we had so much to say about justice and their right to protest. And some of those things got right violent. We didn't hear anybody in America talking about, how horrible the violence was at the protests. All we did was talk about how appropriate it was that they were protesting, right? And we look at other countries and we're in favor of, democratic principles and freedom of speech, and we don't talk about what their governments are facing if it goes bad or if there's fires and all that. But when it happens here, the same people who, want to say it's, we understand, they want to spend the next, 4/5 of the conversation talking about how the burning and looting is unacceptable. Well, of course the burning and looting is unacceptable. Done. Okay, let's get back to the point of discussion.
Yes. Dr. Hill, before we were recording this earlier, you asked me, you look tired. And I know I kind of wiggled my answer there, but I will tell you the truth on why I look how I looked.
Okay.
Is because I am not happy, to say the least, with everything that's going on. And why does it take to have a recording just to have this situation wherein we all are aware that this is what's going on? Just like what you've identified, as I saw that video as well, of go ahead and stand up. And nobody stood up. And when I communicated with you over the weekend, I've been trying to go ahead and formulate in my head how exactly am I going to approach this in the best way possible without, I'm a human being. Emotions are there. And so I've been trying to go ahead and find ways on how to make sense of this. And again, the focus here is from an educational and informational point of view. And not just, that's my opinion and that's it.
Right.
So with that, okay, we already know this is a problem. Protest is one way to go ahead and present, okay, this is a problem. Now, what 2 or 3 solutions can you go ahead and identify to help make these necessary changes?
Oh.
And I know it's more complicated than that, but we have to begin somewhere.
Right. Well, we keep starting over again, right? We keep getting sort of incremental improvement, and then we go back. So, for instance, in Maryland, we've been trying to work and revise the law enforcement Bill of Rights for at least the last 4, 5, 6 years, ever since, even before Freddie Gray, but certainly with that. And we get a lot of resistance from law enforcement. And some of that maybe sometimes they see things from perspective that we don't, so their input is important. But again, I get really tired. I got really tired when Black Lives Matter became a, Blue Lives Matter response. Of course, Blue Lives Matter. All lives matter. But all lives mattering is not in question based on the conduct that we see in public. So the way people conduct themselves in public, there is no question that white lives matter. There is no question that blue lives matter. What is controversial based on public behavior over centuries is whether Black lives matter, right? So, if there's a fire in the neighborhood, I want the hoses to be pointed at the house that's burning. I don't want to hear, well, my house is important too. I know it's not on fire, but my house is important too. Shouldn't you be hosing me down? No, your house is important, but your house isn't on fire. Okay? So I think we have to stop that sort of defensive that, that somehow it is worse to be accused than to be accused of being a participant in the system than it is to be the victim of the system, right? That being accused, let's take it out of race, being accused as being a sexual offender is somehow worse than being the person who was sexually assaulted. They're just not equivalent. but that's what ends up happening, right? So everyone has their rights, but somehow I'm supposed to be more offended or step down because you're hurt to be accused based on your behavior, your language, and your words of perpetrating or being a participant, passive or otherwise, in the problem. We need to stop that. So I think obviously we have to have more conversations, but what people are saying is conversations without substantive action, right? Substantive action. So what made the kneeling thing a little bit different is that you did hear law enforcement, sometimes privately, sometimes on the record around the country saying, that doesn't look like training to me. I mean, you saw a little bit about, there is some controversy about whether that technique is really, a lethal technique or not. It can be used effectively and, but you just have to know when to get off. Well, whatever. We also know that the original autopsy said, there's no evidence of asphyxiation, right? But the independent autopsy says there's plenty of evidence of asphyxiation. I understand the call for more arrest, but as I said to someone who said, well, will you call for them all to be charged with first-degree murder? I said, one of the reasons I think a lot of the law enforcement folks who we've seen actually go to trial or acquitted is because they're charged with the wrong offense, either deliberately or by accident. And so if it's the wrong offense, you're not going to get a conviction. And so I kind of want the charges to be the right charges.
Yes.
Right. So it's interesting. We got a letter earlier today from the Baltimore County Superintendent of Schools, who had sent a notice out to the families in his under his care to let them know that they were setting up behavioral health counseling supports for students. And I just thought, wow, he's really looking at something that all of us should be more in tune to. So in the middle of the pandemic, in the middle of, what does coronavirus mean to my ability to be with my friends, my ability to get an education, my ability to have a future, my parents are maybe not making money because all of a sudden they're not, all of this, they're seeing it out over and over and over again. People being shot down by average citizens who claim, in almost in vigilante style, that they're exercising their right to a citizen's arrest, right? And that they have the right to do that, that their actions, so someone acting in self-defense, when you point a gun at them who fights with you over the gun, real possibility that, hey, you weren't supposed to fight with them when they put that gun with you. Really, well, then what was I supposed to do? But, 2.5, 3 months before there's even a charge. Don't know how the case will come out. So kids are seeing that. Then they're seeing the police, the people who we work really, really hard to teach them to trust. And I'm not just talking about the Black kids or the Latino kids or the other folks of color, the brown kids. I'm talking about all our kids. So they're told that. And they're even told that the protest, they're told that the president says that Colin Kaepernick was wrong to be on a knee and protest. And the NFL said he was wrong to protest police brutality in a peaceful way, that his peaceful protest was inappropriate, that he should have been fired, that, that those athletes basically need to stay on the plantation and stay out in the field and do their job and not mess, in grown-up people's business. So they're told all of that. And then they see this video. And you have to imagine, what is the question that they're asking about what we've told them about what we stand for as a country and what justice looks like and what they saw. Okay? So I really appreciate Superintendent Williams recognizing that it's not just us as adults who have to decide what's next and how do we not get back to normal, because the normal was not what it should have been, right? We don't want to go back to a normal that continues to allow this kind of stuff to go unchecked, okay? Where it is the norm, right? We want a different reality, where justice is real and it's not just lip talk, right? And that's what these kids, but they have to deal with this, this, I was told this about what my country stands for, but this is what I'm seeing.
This is
okay?
different.
Right. This is our kids.
Yes.
This is our kids. Sometimes we forget how the everyday hypocrisies that somehow roll off our backs shape their futures. How everyday traumas, like dripping water, sort of like we're waterboarding our kids, right? Drip, drip, drip. And we forget about what that impact is. And to digress a little bit, but as an example, when Osama bin Laden was captured and killed in 2011, and the announcement was made, the news organizations showed citizens' reactions all around the country, but the most vocal reactions were on college campuses. And if you go back and look at news clips, you'll see college campus after college campus after college campus, where kids were out of the dorm celebrating, drinking, just celebrating. And the exuberance with which they celebrated was shocking to me when I realized that those 18, 19, and 20-year-olds had been 8, 9, and 10 when 9/11 happened. And what was surprising to me is they were celebrating like they all exhaled at the same moment. And I had lost track that was a generation of kids who had been holding their breath for 10 years, who at the age of 8, 9, 10, when you generally feel like your world is pretty safe and that your country is a pretty safe place, things may be not great in other places, but where you live, and there may not be perfect here, but it's pretty safe, where their whole world was rocked. And it occurred to me that, so for 10 years, this person who was just a name to them when 9/11 happened was the boogeyman under their bed and in their closet, who was threatening their future as they grew towards adulthood. And I don't think that as adults, we had any appreciation for the trauma of 9/11 on their psyches because they were so young. And it was that night when across the country they all exhaled that it struck me. So when you go from that to school shootings, at a rapid pace, and folks telling you that you're not supposed to be concerned about the guns, and when you're from, the school in Florida, I forget the name right now, and you start a student movement that says, this can't stand, these are our classmates, and it is our lives at risk. And, national personalities go on and accuse you of being basically ploys and make all kinds of, attack you personally, right? And our leadership at the highest level just stands by and allows it, right? So it is really critical. It's always been important for us to get this thing right. But I think that for me, the need to get this right now, once and for all, and the opportunity, frankly, that a pandemic, which has caused the whole world to pause at the same time, offers for us to come out different than we came in, right? Those things converge for a purpose and a reason. And I think it would be really terrific if we have those really important conversations at every level, at the community level, at the government level, local, state, federal, and that we be willing to say, even though we're going, depending on what we say, we're going to be bullied and chastised and all that kind of stuff. And that we be mindful not to bully others if we don't want to be bullied.
Yes.
And that we actually just say, let me just listen for a second and let me see if I can understand what you're saying. Don't have to agree with it, but let me at least hear you. I think we can we're just not going to take it anymore. I just think we don't have a choice but to come out. And I know my colleagues and I are in conversations about legislatively what that might look like. I don't know how much work we're going to be able to put in over the interim, but wouldn't it be great? Wouldn't it be great if the police unions took the lead? Wouldn't that be great?
Yeah. That it's not coming from the outside pressure, if you may. It's from within.
Yeah.
Just going back to that kindergarten saying of, you don't let the fox manage
The hen house.
the hen house. And so, if you don't mind, I'll go ahead and answer my own question on how I can be part of this solution. Is that one of the things that, let's go back and how we transition to this conversation is that in relation to authority or listening to authority, by all means we respect it and we try to honor the laws and regulations as much as possible, of course. But at the same time, just like if all of these evidence are contrary to that, and that's why we are where we are right now.
Right.
And just like all the things that have been discussed of what's been being passed on from one generation to another, that hopefully us adults will continue to go ahead and be that change so that we would be better examples for the next generation and the generation to come.
But it may be that they have to be the change. Maybe we have to follow their lead.
By all means, yes.
And I think it's also important that we both not let law enforcement off the hook, but also understand how challenging it is sometimes, the job we put them in. And ultimately, law enforcement does what the government and society tells them to do.
Or allows them to do.
Or allows them to do. So if we as a community have decided that we want a barrier to separate a them from an us, and we prioritize that barrier not be breached, and we tell law enforcement to use whatever any means necessary, that's what they're going to do. If we tell law enforcement the barrier can come down in the evenings, but it has to go back up in the morning, or the reverse, and that we want people, to come through, whatever it is, and I'm using that, illustratively, they follow what we ask them to do. They enforce the rules that we as a society decide are there. And so if there are people in our society for whom laws are designed to allow us to have a carefree life, law enforcement will bend over backwards to make sure that we have a carefree life. And if we as a society decide that there are elements that we don't want to move beyond a certain geographic area, then their task is to make sure those folks don't move beyond that area. right? So they are a reflection of who we are. They're a reflection of the policy decisions that we make. So I don't want us as a society, I don't care whether we've had no voice in society or a huge voice in society, I don't want them to be our scapegoats, because law enforcement is us too.
Yes, absolutely. And on that note, we control what we can control and be the change.
That we want to see.
Yeah. And so with everything that's going on, yes, we continue to move that barrier, or hopefully remove that barrier, and that all of us are able to go ahead and work in that direction, if you may.
Mm-hmm.
And some of the things that we've been discussing, just like what you've identified, and even prior all of the things happening, there's a lot of evidence already when Ocean City opened up and there's no physical distancing, if you may. And then when all of these other footage of people carrying, I guess, legal firearms, that's why they're just carrying it around and moving into a government building. Okay, we have those things happening. And then now we have these protests happening as well. So in short, we have all of these group of individuals together, closely knit, and we just go back to this COVID-19 reality.
Right.
It's going to impact all of the other things. And just going back to the solution, if you may, one thing I can go ahead and share, as with my background in psychology and counseling, as I have taught diversity courses, and I always tell my students that this is one of the most challenging courses I have taught. And what I mean by that is because I'm teaching things that are different from me. And all I can do is base it from the book. And on that note, I am not going to say I'm an expert of all of these things. The reason why I'm bringing that up is because one of the things that we need to all identify is that all of us are Homo sapiens. That's our classification.
Right.
But when we identify race or ethnicity and skin color or whatever we wear, all of a sudden we have all of these social thoughts or perspectives, and how am I going to act or react, or even the unconscious bias, if you may, that's already impacting us.
Right.
So all I can share to everyone, that hopefully as part of a solution, that we continue to look beyond that. And I understand it's challenging. And even for myself, we continue to have a level of awareness on how we go about things and how we live our lives. So that way we can continue to evolve in a better situation and not go back to where we continue to be. And every time I teach this diversity course, every semester, there will be one student that will approach me and they will tell me that I am a closet white supremacist. And I will tell them, thank you for trusting me. Thank you for sharing that with me. And I tell them, I don't tell them to change their views, because now I'm not going to be any different from them.
Right.
All I can go ahead and share is that hopefully this course has helped you to take your blinders off a little bit more and have a better perspective on things. But I guess the fact that they're approaching me with that in itself is education involved, and a little bit more of critical thinking involved. And then just going back to the mental health perspective, as you've identified earlier, That's why I'm facilitating these Strength Through Stress sessions, including these virtual town hall sessions. And one of the things that I've been focusing on is the critical thinking component and scientific thinking. And that's where, whether it's COVID-19, race relations, communities, and so on and so forth, that hopefully we all become more of a critical and scientific thinkers in one shape or form. So, Dr. Hill, I hope you don't mind that I had to share a little bit more.
No, that's fine. Right. It's a good way to, I guess, to end up, our conversation.
Yeah, thank you. And on that note, I know when we were discussing if we can point out a nonprofit organization that you want to highlight and care to just discuss.
But, I think there's so many balls in the air right now. Mm-hmm. And not-for-profit organizations are being called on to do so much good work, and they're so compromised right now that there is no single one. If you don't have one, that, I say to the viewers and the listeners, if you don't have a particular organization that whose work you admire and you like to support, please, if you whatever you have, $5, whatever you have, please find one and see if you can make a difference by just giving them, that $5. Even if you used to normally give them $50, maybe you can give them $5 right now because things are just as tight as they are. But whether that's, NAACP, whether it's the Southern Poverty Law Center, whether it's Doctors Without Borders, whether it's the American Red Cross, whether it's the Maryland Food Bank or the Baltimore County or Howard County food banks or the Community Action Council, groups are trying to do the work on behalf of our citizenry that needs to be done, and they need our support. And there are just too many balls in the air right now for me to single out any particular organization, but I would encourage people to just recognize that a lot of work needs to be done, and there are groups out there. There are groups, Black Lives Matter. Again, I could go on and on, but just find a group,
And I think that's a really solid way to end this session. And I'm sorry we got extended here, Dr. Hill. But yes, in spite of all of these challenges, starting from COVID-19 to everything that's going on from race relations and the police officers and other systemic issues, is that in spite of, there are so many good people there, there's so many good organizations there doing really good stuff. And just like what Dr. Hill identified, and not only from a financial point of view, however you can safely volunteer or however you can provide support. And at least on my end, that's what I'm just trying to go ahead and do, is just to go ahead and share these things, if you may. So, all right. Any other last thoughts, Dr. Hill?
No, I think, I read something. Well, I guess I do have one. I was reading, it was a Living Word or something this week. And the point that was being made was that so many times we feel like we're constrained from doing our best or from doing the thing that we want to do to make a difference. And we'll say things like, well, when this turns around, when my situation changes, when I'm no longer encumbered by this, then I'll do something. And the writer of the reflection was saying, that sometimes we're just called to do in the moment that we're in, that waiting for it to be the perfect time to make a contribution, waiting for it to be the perfect time to stand up and say something or whatever, waiting to do the thing we really want to do may simply, have us doing nothing. That do what we can in the moment that we're in. And that's something. And that's what we're called to do is, it's sort of like, we'll say, bloom where you're planted. It might be nice to be in a whole different garden, but if this is where you are, this is where you need to bloom.
And that's a really great way to go ahead and end this. So please, wherever you are, whatever your situation is, we can only relate to you as much as well. But if we continue to help each other out and see how you can move that one step forward in one shape or form, But at the same time, if you need to stay where you are and just stay there and be still, that is completely fine. But
That helps us.
have that motivation to continue to move forward, and hopefully that moving forward is in a very good direction.
Right.
Dr.
Thank you so
Hill,
much. Yeah.
thank you. And to everybody else out there, please be safe. Please continue to listen to science. Please continue to listen to medical researchers and be as a critical thinker and a scientific thinker as you can be. And let's all help each other out more than just all the other stuff that's going on. So,
Be
thank you.
safe, be well.
Thank you.
All right. Take care. Thanks again.
Thank you for watching, and I hope you found this video informational and educational. Please share our videos and subscribe to our channel. If not, my dad will not give me dessert.